Hello again. It's the second lecture of Glossary of Periodontology by Dr. Harim Jaffer. Please subscribe to my channel HL Talent. In the previous lecture, we were at the letter A, part 1. We reached to the letter A followed by L. And today we are discussing the letter A's which followed by N. And we have 10 terms. The first term is Anachoresis. This is a synonym to bacteremia. For example, it's the process by which a microorganism comes through the blood and lymphs, and when it will reach the damaged tissue, it will leave the blood and lymph and enter to the damaged tissue, and it will establish an infection. The term angulation we discussed in the previous lecture, adaptation and activation. While angulation of instrument is the angle that you form it between the active surface of the instrument and the root surface or the tooth surface in general. So this is angulation of instrument. Antibody, also called immunoglobulins, are a group of serum molecules produced by adaptive immune system by B lymphocytes. And we have 5 different types: IgG, IgA, IgM, IgD, and IgE. They are the defenders of our body, while antigens, they are the invaders. So any molecules that can be specifically recognized by the antibody or by T cells and B cells are called antigens. They invade, they protect. The term antibiotic are naturally occurring semi-synthetic type of anti-infective agents that destroy or inhibit the growth of selective type of microorganisms. Generally, we are using it at low concentration. While antiseptics are chemical antimicrobial agents applied topically or subgingivally to mucous membrane or on the wounds or on the intact dermal surfaces to destroy microorganisms and inhibit their reproduction or metabolism. But antiseptics is not the process of sterilization. They just kill some types of bacteria, not all of them. They are not killing the spores. Okay, so they are inhibitor, and they can destroy some types of microorganisms. We have the term anaphylaxis, which is immediate hypersensitivity response to antigenic challenge, mediated by the antibody IgE and the histamines in the mast cells. Typically, the anaphylactic shock is life-threatening. For example, it includes the symptoms of rashes and redness in the skin, cough and shortness of breath in the respiratory tract, vomiting, diarrhea, and GIT, and also the dizziness and weakness of the pulses in the cardiovascular system, and also it introduce or cause an anxiety in the patient, and most of the time is life-threatening if it is not managed well. The term anaerobic mean any kinds of microorganism that can survive and grow in the presence of oxygen. We have aerobic and anaerobic bacteria. The anaerobic doesn't need any oxygen for multiplication or for sustaining inside the tissue. Anatomical landmarks, any recognizable anatomical structure that we are using it as a reference point. Even in the orthodontic, while we are doing orthodontic appliances or we are doing surgical treatment, for example, when we place an implant here, we have a landmark of mandibular foramen. The 18 is mandibular canal or mandibular foramen. Here there will be an inferior alveolar nerve. So we should be aware while placing an implant, not impinging on that nerve and causing paresthesia. So this is the importance of the anatomical landmarks. Analgesia is the term of absence of sensibility. You feel a relief from pain and you have totally conscious, and you are not out of consciousness. Just like when we are giving local anesthesia, the patients have a relief from pain, but they are still conscious. This is the last term for today. I hope you all get benefit from it, and thank you for your listening.